After a multi-year effort, Defense Department health and tech officials got a new electronic health record system completed. The last deployment took place in March. The Government Accountability Office finds user satisfaction with the new system still doesn't match that of the old one. We get more now from the GAO's Director of Information Technology Acquisition Management, Carol Harris. Ms. Harris, good to have you back.
Thanks for having me back.
So is this a case of the new system is finally up and running, the bugs are out, and people just don't like it? Or is there more going on here?
Well, I think it's a little bit of both. As you said, DoD has fully completed their deployment of MHS Genesis to all of its military treatment facilities around the world. And their final site was at the Federal Healthcare Center in North Chicago. Now, this FHCC, the center, is somewhat unique because it's actually a joint facility with VA. And so when DoD and VA implemented the Federal Electronic Health Record system there, they still have additional work that they need to do. There's additional opportunities for integration between the two departments' workflows in particular. So, for example, there are 69 topics to address to bridge the differences between both DoD and VA. Now, 31 topics have a path forward to integration. 38 of them do not. And these topics include patient care locations, pharmacy organization, and the dental module. So I'll give you an example at the Federal Healthcare Center. It has a single physical pharmacy that provides care for both the DoD and VA patients, but DoD and VA have different medication costs, different copays, different billing systems. And so ultimately, the two departments decided that a single system option just wasn't viable. And so what's happening now is pharmacy end users, including pharmacists, are having to switch between the DoD and VA pharmacies in the system. And then for the dental module, the dental staff are having to use different systems for the DoD and VA patients. So as a result, the clinic actually has two computers at each workstation so that both systems can be used simultaneously.
Yeah, so hello, clearly, 1970s again.
Right. So clearly there's still work that needs to be done to get things further integrated at the Federal Healthcare Center in North Chicago. But as you said earlier, user satisfaction is also a major issue. So DoD has 2 years worth of survey data. DoD's 2023 survey showed improved satisfaction from the previous year, but system users are still generally dissatisfied with system response time, with the user's ability to work as efficiently as possible, as well as their ability to deliver high quality care. So, for example, like when you take a look at the quality care aspect, in 2023, only 29% of MHS Genesis users agreed that the system enabled them to deliver high quality care, compared to 46% of the legacy system users, and even 50% of the private sector users of the same commercial system that was just deployed.
Sure. So a lot of issues here. Talking about satisfaction, it looks like nobody loves any of the systems. I mean, the legacy system has a 56% patient-centered care rating. Everything else is below 50. They just like the new one a little bit less than the old one.
Right. And so, our work on leading practices emphasizes that agencies should proactively be employing these user satisfaction data to improve the performance of the system, and then also monitor progress against goals to understand whether user needs have been met. And so at this time, what we found is that DoD hasn't yet established any goals or plans for improving survey results. So we did go ahead and make a recommendation in that vein.
We're speaking with Carol Harris, Director of Information Technology Acquisition Management at the GAO. And what was that recommendation specifically to get the satisfaction improved?
Well, it was specifically for DoD to establish user satisfaction goals, and then from there to monitor progress against those goals.
It's like a FEVS score for the health system, you might say.
Yeah, exactly.
But to the other issue where a couple of or several dozen integration issues don't seem to be resolvable, how does that square with the ultimate vision of this billions and billions and billions of spending by both agencies, VA and DoD, for the specific purpose of having a single interoperable record?
Right. Well, in the case of the Federal Healthcare Center in North Chicago, DoD and VA said that there are legal and policy barriers that are precluding them from fully integrating. But when we dug down deeper with those departments, they couldn't be specific about what those barriers are. And so regardless of what they are, if additional steps aren't taken to rectify this, they're not going to meet that integration goal. And DoD and VA have been working on the exchange of electronic health records since 1998. I mean, this is a long-standing problem. So we did make a recommendation for both departments to address the specific barriers that are halting the integration at this particular site.
Because in the 1990s, the advent of e-government, when large digital platforms, I mean, it was, just a continuation of the COTS or commercial off-the-shelf adoption idea. One of the notions was, well, the government, rather than adopt software to what government does, the government should adopt its business practices to match what the software does. That was one strain of thinking. Has anyone looked at whether the pharmacy practices and the other practices that are incompatible, those could be changed so that they work together with the software?
Right. And I think what DoD and VA currently, what their position is that there are legal and policy barriers that are preventing them from addressing those workflows to match the commercial workflows in order to be fully integrated. So both departments need to come to terms with this and to rectify the situation, because having two computers at each workstation is not a sustainable solution.
Right. I mean, there could be, I can think of ways they could get around it, but those are always more complicated than they seem like because it takes programming. And in the meantime, as the VA creeps up on more and more deployments, it sounds like there will be other instances of joint locations. I mean, this is not the only one that's cooperated, or is it?
This is the only one where there's a joint facility. However, DoD and VA still need to have a solution where they're able to exchange the electronic health records. So they're still going to have to come up with ways to be able to do this. So it's still a very long journey for the two departments. And while they are acquiring the same commercial system, again, the two departments have very different workflows in different areas. Like as I mentioned with the pharmacy and with the dental ones, I mean, those are just, some examples, but there are many. So DoD and VA are both going to have to work through this for quite a long time. And at this time, VA has halted their implementation of their system for now, but they did proceed forward with the North Chicago site because DoD needed to complete theirs. So there's still, a lot of learning that can take place from this particular site, but again, a long journey for the two.
And do you sense that there may be a type of hybrid solution where, no, they're never going to be compatible in these areas, but at the point of departure from DoD, the record moves to VA, and then VA updates it with its pharmacy and other practices, and you kind of have a virtual, I don't know, for lack of a better word, compatibility?
Yeah, I mean, I could see that, certainly. And it's going to be up to the two departments to make business decisions about how that's going to look like. And so at this time, I know that there's work ongoing for that, but it's still quite a long road to hash out every single aspect of the healthcare system for the two.
And briefly, you had some other recommendations besides establishing user satisfaction goals. Maybe highlight those for us.
Sure. So in addition to addressing those specific barriers to halting integration at the joint facility, we also made recommendation on providing an alternative to the current dental module. The module is called Dentrix, and it's just not able to scale at the rate that is necessary for both DoD and VA. And so problems with this module began as early as October of 2018. Their workaround had been to turn off a vital interface for sharing patient dental and medical records for Dentrix. And that's really, kept it minimally functional at this point. So since the program office has been unable to correct those problems, they have begun work to identify alternatives. The problem is there are no dates or estimates for when the Dentrix issue is going to be either resolved, or a plan or a schedule for identifying those alternatives. So we made a recommendation in that vein.
And the recommendations get pretty much agreement from the department?
Well, VA concurred with the recommendation that we made to them in terms of working with DoD to address those integration issues. DoD also concurred with that recommendation, but they only partially concurred with the remaining ones, although in their comment letter, they didn't specifically cite what their disagreements were. So we're going to continue to monitor the recommendations and what actions that they're going to take, and hopefully they will fully implement.
Carol Harris is Director of Information Technology Acquisition Management at the Government Accountability Office. Thanks so much for joining me.
Thanks, Tom.
And we'll post this interview along with a link to her report at federalnewsnetwork.com/Federal Drive. Hear the Federal Drive on demand. Subscribe wherever you get your podcasts.